I want to talk to you today about something that is everywhere in wellness culture, and that, for some of you, may be quietly working against your fertility every single day. Cold. Not the cold of winter, although that matters too. The cold of the morning smoothie, the iced coffee you grab on the way to work, the cold gym session on day 2 of your period, the exposed midriff in an air-conditioned office, the raw salad that feels virtuous but leaves you bloated and cramping. In Chinese medicine, these are not small things. These are daily inputs into a system that is highly sensitive to temperature, particularly the uterus. And for women who are already carrying a cold pattern, these habits are not neutral. They're accumulative. They compound over time, and they can significantly impair both menstrual cycle and the conditions needed for conception. Hey everyone, welcome back to the channel. If you're new here, I'm Megan, and I help women navigate their fertility journey using traditional Chinese medicine and holistic practices. Today, I'm going to show you exactly how cold works in the body according to TCM, and what it does to your cycle, what it does to your fertility, and importantly, what you can actually do about it. Let's start with the foundational principle, because once you understand this, everything else makes sense. Cold contracts, cold slows, and cold congeals. Think about what happens to water when it gets cold. It thickens, it slows, eventually it freezes, it stops moving entirely. The same principle applies inside the body. When cold accumulates in the uterus, it causes the tissue to contract and tighten. It slows the movement of blood. It impairs the uterus's ability to contract efficiently during menstruation, which means blood cannot move freely. It pools, it thickens, it congeals. The result is pain, clots, incomplete shedding, and difficult cycles. Over time, if cold is not addressed, it creates the terrain for stagnation to deepen. We're back to that word, terrain. The terrain determines the experience, and a cold terrain is one of the most hostile environments for both comfortable menstruation and successful conception. In TCM, cold can enter the uterus in 2 primary ways: externally through environmental exposure, diet and lifestyle, and internally through constitutional deficiencies, particularly kidney yang deficiency, where the body simply doesn't generate enough internal warmth to maintain healthy function. Today, we're focusing primarily on the external, the lifestyle habits that introduce cold into the system, because this is the layer where we have the most immediate agency. The 4 key habits. Let's go through the most common modern habits that introduce cold into the system, because several of them are disguised as healthy choices. This is the part of the conversation that can feel confronting, and I want to hold it with care. I'm not telling you that you're doing everything wrong. I'm offering you a new lens which to evaluate what your body is communicating. Habit 1. Iced drinks and cold beverages. This is the one that surprises people the most, because we live in a culture where a cold drink feels refreshing, normal, even healthy. And for some body types and some constitution, it is relatively neutral. But for women with a cold pattern, especially cold in the uterus, cold drinks are a direct energetic input into a system that is already struggling to maintain warmth. Every iced coffee, every cold glass of water, every smoothie pulled straight from the fridge is asking the digestive system, and by extension, the entire body, to work harder at warming that substance before it can be processed. This is not abstract. In TCM, the stomach and the spleen govern digestion and are deeply involved in the production of qi and blood. They function optimally at warmth. When cold is consistently introduced, digestive function weakens, qi production suffers, and the downstream effects ripple outward, including to the uterus. The practical shift here is simple but significant. Swap ice drinks for room temperature or warm during the luteal phase of the menstruation. And if you're carrying a cold pattern. Habit 2. Cold smoothies and raw food diets. Green smoothies are almost universally positioned as the gold standard of health food, and they contain genuinely nourishing ingredients. But the way that they are consumed, cold, raw, often first thing in the morning, is a mismatch for many constitutions, especially those with cold or spleen deficiency patterns. Raw food in TCM is considered harder to transform. The spleen prefers warm, cooked food that's been partially broken down by heat. This reduces the energetic cost of digestion and allows more qi and blood to be produced from what you eat. A cold, raw smoothie on an empty stomach first thing in the morning is asking the spleen that is already deficient to do significant work before it has even warmed up for the day. Over time, this depletes spleen qi, weakens blood production, and can contribute to the very deficiency patterns that make cold stagnation worse. This doesn't mean never eat raw foods. It means if you're carrying a cold or spleen deficiency pattern, consider warming your smoothies slightly, adding warming spices like ginger or cinnamon, or shifting to cooked breakfasts during your menstrual and luteal phases. Habit 3. Expose midriff and lumbar area. This one sounds almost old-fashioned when you say it out loud, but it's clinically relevant and deeply rooted in TCM tradition. The lower abdomen and lower back, the area surrounding the uterus and the kidney meridian, are energetically sensitive to cold exposure. Sitting on cold surfaces, wearing crop tops in air conditioning, leaving the lower back exposed in cold weather, all of these allow cold to penetrate the exterior and begin to accumulate in the pelvic region. Many of my patients are surprised when I ask about their clothing and environment, but I have seen women whose pain significantly improves when they start keeping their lower abdomen and lumbar area warm. Something as simple as wearing a wide waistband, keeping a blanket across the lap when sitting at the desk, or switching to warmer layers during winter. It sounds small, the results are often not small at all. Habit 4. Over-exercise during menstruation. Exercise during menstruation is a nuanced conversation, and I want to be precise here because the message isn't don't move your body. In TCM, menstruation is a time of downward movement and release. The body is actively shedding, descending, clearing. High-intensity exercises, particularly in cold environments or exercises that significantly lowers body temperature, can disrupt this process. Intense exercise during menstruation can redirect qi upward and outward at a time when the body needs to move downward and inward. It can also introduce cold through sweating and then cooling rapidly through exercising in cold conditions without adequate covering of the lower body. The clinical picture I often see is women who push through heavy, painful periods at the gym because they've been taught that exercise helps with cramps. Sometimes it does. Gentle movement can support circulation and ease mild stagnation. But for women with cold-stasis patterns, high-intensity cold environment exercise during menstruation can deepen the very pattern that is causing the pain. The practical correction: honor the first 2 days of your period as a time of relative rest and warmth. Gentle walking, yin yoga, restorative movement. Save the intensity for your follicular and ovulatory phases, when your body has the energetic reserves to support it. Habit 5. Cold plunges. I know this one's going to land differently because cold plunging is having a major cultural moment right now. And I want to be very clear, I am not here to tell you that cold plunges are universally harmful. For some people, in some contexts, they have genuine benefits. But I do need to have an honest conversation about what they can do to women who are already carrying a cold pattern, and especially women who are trying to conceive. Here's my clinical position. Cold plunges are contraindicated for women with cold stasis patterns. If you already have cold in the uterus, if you have dark clots, the pain that responds to heat, the cold extremities, the pale tongue, deliberately immersing yourself in cold water is not a wellness practice. It's adding fuel to a fire that is already burning cold. It deepens the very pattern that is obstructing your cycle and impairing your fertility. Cold plunges should be avoided entirely during menstruation. Full stop. The menstrual phase is a time of downward movement and release. Cold causes contraction and closure. These two forces are directly opposite. Plunging during your period can cause the uterus to contract and retain blood rather than release it, worsening pain, increasing clotting, and potentially deepening stagnation. I don't recommend cold plunging during menstruation for any of my patients, regardless of their pattern. For women who are actively trying to conceive, I advise against cold plunges in general, not because they are inherently dangerous, but because the stakes are high and the risk to benefit ratio doesn't favor them. We are working to build warmth, nourishment, receptivity in the uterus. Cold plunging works against all three. Context matters. Constitution matters. A robust, young excess constitution may tolerate cold exposure with very little harm. But the women I see in clinical practice, women navigating endometriosis, painful cycles, and fertility challenges, are almost never in that category. They're carrying deficiency, cold, stagnation. For them, cold plunging is not an upgrade. It's a clinical risk. If you love cold plunging and it makes you feel amazing, I'm asking you to consider whether that response is telling you the full story. And I'm asking you, at minimum, to keep it away from your menstrual window and to reassess if you're carrying the signs of uterine cold that we are about to discuss. Recognizing cold in the uterus. Now let's talk about how to recognize whether cold is a significant pattern for you. These are the key clinical indicators I look for. Sign 1. Pain that improves with heat. This is the most reliable indicator. If a hot water bottle or a heat pack or a warm bath significantly reduces menstrual pain, cold is involved. The heat is providing what the body is lacking: warmth to soften the contraction, stimulate circulation, and allow blood to move more freely. When heat makes pain worse, we are usually looking at a heat pattern, a different clinical picture entirely. Thermal response is one of the most diagnostic questions I ask in our first consultation. Sign 2. Sharp, fixed pain. Cold causes contraction and fixation. The pain associated with uterine cold is often sharp, cramping, and located in a fixed position, typically the lower abdomen, sometimes radiating to the lower back or inner thighs. It doesn't move around, it grips. This is distinct from the distending, moving pain of liver-qi constraint, which tends to shift and is worse with stress. Cold pain is fixed, cold, and often severe. Sign 3. Dark clots in the menstrual blood. The color and consistency of menstrual blood is extraordinarily informative in TCM and almost entirely ignored in conventional medicine unless something is dramatically abnormal. Dark, purplish-black clots in menstrual blood indicate congealed blood, blood that has thickened and pooled before being expelled. This is the physical manifestation of cold, slowing blood movement in the uterus. The darker and the more clotted the blood, the more significant the Cold-Stasis picture. Bright red blood that flows freely is the goal. Dark, clotted blood with cramping is a communication. And now you know how to read it. Additional signs to watch for. Other indicators of a cold pattern include feeling cold generally, particularly in the hands and in the feet, the lower abdomen, low libido, fatigue that feels particularly deep, pale or slightly bluish lips, a preference for warmth in all aspects of life, and a pale, moist tongue with a white coating, restoring warmth and rhythm. Let's make this actionable. These are the lifestyle corrections I consistently recommend for women with cold patterns, those preparing for conception. Warming the diet. Shift towards warm, cooked foods as your dietary foundation, especially during menstruation and the luteal phase. Soups, stews, congee, roasted vegetables, warming grain. Incorporate warming spices daily. Ginger is your most powerful ally here, followed by cinnamon, cardamom, black pepper, and cloves. Ginger tea. Fresh ginger roots steeped in hot water is one of the simplest and most effective things a woman with a cold pattern can do daily. It warms the middle, supports digestion, moves blood gently, and is safe throughout the menstrual cycle and into the preconception period. Reduce or eliminate cold and raw foods, first thing in the morning and during menstruation. This doesn't mean you never eat salad again. It means you build your dietary foundation on warmth and add raw foods as a small component, ideally at room temperature. Warming the body. Keep the lower abdomen and lower back covered, especially in air-conditioned environments during the winter and around menstruation. A simple knitted waistband or a warm wrap, or even keeping a small heat pack at your desk can make meaningful differences over time. Warm baths in the week before your period are therapeutic, not indulgent. Add ginger or Epsom salts, soak for 20 minutes, let the warmth penetrate. Moxibustion, the burning of dried mugwort herb over specific acupuncture points, is one of the most powerful tools in TCM for warming the uterus. If you're working with a TCM practitioner, ask about home moxa practice on points like Rempor, Wanyuan, and Stomach 36, Zusanli. This is something I teach patients to do themselves between sessions. Honoring menstrual rest. I want to revisit this because it deserves its own moment. Resting during menstruation is not weakness, it's not laziness, it's biological intelligence. In TCM, the menstrual phase is governed by the same energetics that govern winter. It is the time of inward movement, of release and restoration. When we push through this phase with intensity, high-impact exercises, late nights, high stress, cold environments, we're working against a physiological process that is trying to clear and reset. Over time, consistency, overriding menstrual rest deepens deficiency and can worsen cold-stasis patterns. Giving your body even 1 or 2 days of genuine rest at the start of your period is not a sacrifice. It's an investment in the health of every cycle that follows. This is especially important for women preparing for conception. The cycle you honor now is the cycle that will support implantation next month. Here's what I want you to take from this video. Cold is not a dramatic diagnosis. It doesn't show up on a scan. No one is going to tell you in a medical appointment that your morning smoothie is contributing to your period pain. But in TCM, the accumulation of small daily inputs over months, over years, creates the terrain. And the terrain determines the experience. Here is the extraordinary thing. Terrain can be changed. Not overnight, but consistently, incrementally, with the right daily practices. Warmth restored gradually is warmth that holds. A cycle that improves because you change the terrain, improves in a way that lasts. Cold is the most underestimated fertility saboteur because it hides in plain sight, in the habits we have been told are healthy, in the culture of pushing through, and in the normalization of pain that actually is a signal. Your body is not punishing you, it's communicating. And today, you learned one of the most important languages. If you recognize yourself in this video, if cold is part of your pattern, and if you want to understand exactly how it's showing up in your cycle and what to do about it, specifically for fertility, I want to invite you to schedule an initial appointment with me at the Acupuncture Oasis in downtown Toronto or with a practitioner near you. This is where we can map your full TCM pattern, look at your cycles as the vital sign it is, and build a personalized strategy, not a generic protocol. Your specific terrain, your specific intervention. And if you're looking for a gentle, body-honoring movement practice that supports your cycle rather than working against it, I want to introduce you to the Fearlessly Fertile Yoga. This is a practice designed specifically for women who are preparing for conception, with sequences that honor each phase of your cycle, including, yes, restorative practices for your menstrual phase. The link is below. It is a beautiful place to begin moving in your body in a way that works with fertility and not against it. Until the next video, be curious, be informed, and be vibrant.